Throughout the semester, as students of health aspects of aging, we evaluated 5 cases regarding elderly individuals and issues they may come across. The cases focused on issues that plague the elder population. Case 1 was focused on fall prevention and how to help elderly individuals that may be accident prone. Case 2 is focused on medication management and ensuring that prescriptions are being taken exactly how they are prescribed. Case 3 is focused on oral health and nutrition and how these go hand in hand. Case 4 was focused on elder abuse and how to combat it. Case 5 was focused on palliative care and how to care for an elderly individual as they are nearing the end of their life. We examined the cases and found what the biggest concerns were regarding the safety of the individual and how to best help them. We found which individuals or agencies could step in to help, created an intervention or care strategy, figured how we could reduce risks, and came up with plans to help safeguard the individual from harm. Case 1 focused on an 85-year-old male with diabetes, high blood pressure, chronic obstructive pulmonary disease, otherwise known as COPD, and asthma. This individual also lives alone and drinks alcohol frequently. Because this case focuses on fall prevention, it's important to eliminate anything that could cause the individual to fall. In this case, it involves safeguarding his home, deciphering which medications contribute to falls, and changing ones that are dangerous, and also cutting back the individual's alcohol consumption. At the end of the case, we were able to conclude that it is important to consider possible changes in medications, as 2 of his medications were known to cause dizziness, and that is not ideal for someone who is already at risk of falling. The individual must also monitor his diabetes very closely so that it does not play a role in him falling. He should consider moving closer to his son or possibly moving in with his son so that he has someone that can be around if he does fall. If moving is not something he's willing to do, then an agency should be hired to fully safe-proof his house. All of his phones should be relatively reachable from the ground. All clutter should be removed, and any trip hazards also must be removed or resolved. It was important for us to learn about fall prevention because as an individual ages, falling becomes a scary reality. After reviewing this case and the articles that came with it, it became clear that falling is due to a combination of things. Elderly individuals may fall due to a side effect of their medication. They may fall because they are not eating an adequate diet. And they may even fall because they have a health issue that they are not addressing. As a young adult, it seems ridiculous that falling is such a big topic, but it becomes a pressing issue when a fall results in broken bones or even head trauma. Fall prevention is important to understand in order to reduce the risk of elderly loved ones falling and getting seriously injured. Case 2 follows a 70-year-old female who has a large amount of health disparities. Because of her health issues, she has been prescribed a plethora of medications which increases her risk of adverse drug reactions. To safeguard this individual from adverse reactions, it is important to consider how her medications interact and what they can cause. 2 of her medications are known to cause depression, and that needs to be addressed to decipher whether additional medications are needed to combat the depression. She also must monitor her weight and improve her diet. To improve her diet, she needs to work with her dietitian to create a plan that keeps her food intake at a healthy level. The utmost important thing that can be done to prevent reactions is for her to be taking the medication exactly how it is prescribed. Medication management is a very important topic for elderly individuals to understand. As they age, the number of medications they are prescribed raises, and for some, it may skyrocket. Because many medications can only be prescribed by a medical professional, it is important that the medications are being taken only as directed. If someone is not adhering to the directions of the medication, they could overdose on the medication or could negatively be affected by lack of medicine. To stay on a strict routine with pills, medication management is important. Pill organizers can play a crucial role in keeping an elderly individual healthy. It is also of utmost importance that physicians are aware of all of the medications an elderly individuals prescribe, so that medicines do not react and have a negative adverse reaction on the individual and cause harm. Case 3 follows an 85-year-old male who has diabetes and is obese. These 2 conditions coupled together make his nutrition extremely important. Some of the medications he is taking can cause adverse effects that impact his oral health. In order to keep this individual healthy, a team-based approach to his health is important. His children or other loved ones must work hand in hand with health providers to ensure that this individual is on top of his medication intake as well as his nutrition. We only get one set of teeth, And as we age, it becomes extremely important that we take care of our mouth. As an individual ages, gum disease, sensitive teeth, diabetes, and dry mouth can all have an impact on overall mouth health. Nutrition plays a key role in oral health as well. Eating a diet high in sugar negatively affects an individual's teeth and can cause the enamel to break down. Because people are more prone to oral issues as they age, it is important that regular dentist visits are scheduled and that flossing and brushing one's teeth does not get forgotten. Likewise, not having a healthy diet as you age can lead to a large amount of health issues. In order to prevent this, it is important that a healthy and nutritious diet is eaten. If an individual is not capable of creating a healthy diet for themselves, outside agencies should be contacted. Case 4 follows an extremely affluent individual who has been living with dementia for 5 years. This is important to note because the American Journal of Psychiatry states that Alzheimer's disease and other dementias may be associated with greater risk for physical abuse than other illnesses of the elderly. Due to his dementia, this individual gave most of his money to his niece for helping take care of him. However, he only receives $10 a week to buy food. He does not have a large amount of health concerns, but since he has dementia, he is completely reliant on help from his niece. He frequently visits the emergency room, and his niece explains that he is clumsy. However, being clumsy should not result in a trip to the ER. If his falls are purely due to his dementia and being accident-prone, then his home must be fall-proof and injury-proof in case of a fall. If his niece is unable to provide the care that he deserves, then he should be referred to a nursing home that can care for him the way he needs. Elder abuse can be anything from physical, sexual, or emotional abuse, all the way to financial abuse. Abuse can happen to any elderly individual from any background. As an outsider, it is important to look for warning signs that individuals are being abused. For example, warning signs can be depression, visible bruises or cuts, looks messy, has bed sores, and even weight loss. It can happen anywhere, in a nursing home, in a hospital, even in the individual's home. Elderly individuals are not as capable of defending themselves, and it often takes a third party to step in and protect the older adult. There are many agencies that look out for the health and well-being of older adults. As a person ages, they should not have to worry about being abused or mistreated. Case 5 follows a 97-year-old woman who had a heart attack 2 years ago and is living with diabetes, end-stage renal disease, and high blood pressure. She's prescribed 4 medications that she takes each day and receives dialysis every other day in the assisted care facility that she lives in. Due to her age, she is unable to receive a kidney transplant. This individual has a disease that will debilitate her for the rest of her life. She has been living with kidney failure for 7 years and is too old to have a transplant. Because of this, it is in her best interest that she enters a palliative care facility or a hospice facility, where her care can be tailored to keep her comfortable during the end of her life. Her family must help her make decisions and assure her that her comfort is the most important thing. Preparing for this change will help this individual cope with the fact that she is nearing the end of her life. To assure that she has no concerns, she must know all of her options and have set plans that she and her family understand. Palliative care is important for any individual who is dealing with a debilitating disease or illness that has a terminal prognosis. It is even more important for the elder population. Understanding that treatment is no longer an option is important for both the patient and his or her loved ones, and from there, a course of action can be planned. Palliative care provides relief from pain and offers a team approach to address the needs of the patient and their family. Lack of palliative care can result in discomfort from untreated symptoms. Palliative care is a place for terminally ill individuals to receive the care they need that also provides comfort for them and their loved ones. The process of having a loved one pass away is difficult, but through palliative care, both parties understand what is best for the patient and how to best keep them comfortable during the end of their life. As a student, having cases that are applicable to what is being taught during the course helped me better understand the chapters we were learning. The cases opened my eyes up to what elderly individuals go through on a daily basis. The 5 cases are also 5 topics that seem to be the most pressing for the elderly population. This course will enable me to look out for my older loved ones and be more sympathetic towards the process of aging.